What is biomechanical analysis in soccer injury prevention? Imagine watching a soccer game and noticing how some players seem to move with perfect ease, while others show signs of awkward or strained movements. What if we could use science to understand those differences and prevent injuries before they happen? That's where biomechanical analysis comes into play. It is a way to study and measure how players move during training and matches. This involves looking at joint angles, muscle activation, forces on the ground, and running styles. Using special tools like wearable sensors and motion capture cameras, experts gather precise data on every movement. By analyzing this data, teams can spot risky or inefficient movement patterns that might lead to injuries like muscle strains or ligament tears. From a soccer statistics and analytics point of view, biomechanical analysis turns raw movement data into numbers that help assess injury risk. Instead of just guessing, coaches and medical staff get objective information. This data can be combined with other factors like how much a player trains, their heart rate, past injuries, and even weather conditions. When all this information is put together, it creates models that predict how likely a player is to get hurt. These models look at patterns over time, such as sudden increases in sprinting or changes in movement style, which can signal an injury might be coming. In terms of historical trends and predictive modeling, biomechanical data is a key piece. Advanced computer programs, called machine learning algorithms, analyze this data along with GPS tracking and physiological load measurements. They find patterns that often come before injuries happen. For example, if a player suddenly starts running faster but their movement mechanics change, the model might flag this as a warning sign. These tools can detect both quick spikes in activity and gradual buildup of stress over weeks or months. This early warning system helps teams take action before an injury occurs. Practical uses include real-time monitoring during games and practices with wearable sensors that track biomechanics continuously. Coaches and medical staff can see injury risk scores on dashboards, which help them decide when to rest a player or adjust training. For example, if a player's biomechanical data shows imbalance or strain, they might do targeted exercises to fix those issues. Sometimes, players are given modified training routines or less playing time to avoid overload. These insights help keep players healthy and on the field longer. Overall, biomechanical analysis transforms detailed movement data into clear, useful information. It supports smarter decisions to prevent injuries and keep players performing at their best. As part of the larger field of predictive analytics, it combines movement, physiological, and contextual data to create a complete picture of injury risk. This approach makes injury prevention more precise and personalized, helping teams stay competitive and players stay healthy.